Hello and welcome. My name is Mary Catherine Lundquist, and I work at the COPSA Institute for Alzheimer's Disease and Related Disorders at Rutgers University. Thank you for listening in to learn more about how you can help create an environment at your adult day center that is safe and supportive of participants with memory loss. The tips and strategies we are reviewing will benefit the people you are caring for and you as you go about your daily work routines. Thank you for all the good work you are doing. It takes a special person to work in adult day services. I hope these materials help you have a better day at work. This is the sixth in a 7-part series on the Foundation's workbook. You can download a free workbook at our website, www.care2caregivers.com. In part 6, we will be reviewing safety concerns. If you want to follow along in your workbook, this section starts at page 72. Damage to the brain makes people with dementia very vulnerable. No doubt family members have told you horror stories of loved ones taking too many pills, or leaving the pilot light on the stove, or taking the car and getting lost or getting into an accident. Most of the people in our programs are there because they cannot safely be left at home alone. Our centers provide a safe haven for people with dementia, but even here, there are serious hazards. We must always be vigilant if we are to keep our participants safe. We are going to be reviewing some areas related to safety: falls, wandering, activity risks, mealtime safety, assault, and also delirium. A person with dementia may have difficulty when walking and therefore be at an increased risk of a fall, especially as the disease progresses. Those with certain dementias, such as Lewy body disease, frontal temporal lobe dementia, and Parkinson's disease, typically experience more motor and gait disturbances. They have an even higher risk of injury related to falls. Damage to the area of the brain that handles walking causes some participants to experience these changes. It is very important for us to remember that they have no control over these changes. Here are some things we may notice related to a person's gait. We may observe them taking very short, tiny steps. At some times, it may seem as if their feet are just shuffling on the floor and they are not picking up their feet as they walk. They may have poor balance and seem unsteady. Some people may get fatigued and become tired very easily, even when only walking for a short distance. Some of our friends may walk at a very slow pace. Some individuals may experience vision changes related to their memory loss, which makes it hard for them to judge distances, so they may bump into the wall or doorway when walking. A person's posture may be stooped over, and we may find ourselves reminding them to look up when they are walking. And some of our friends might have sudden changes in their pace or their gait throughout the day. In addition to the brain changes, there are other factors that contribute to a person having difficulty walking. They include sometimes the side effects of medications. Most medications that our participants take have side effects, which may make them sleepy or more confused or experience problems being off balance. Medications can cause dizziness or a drop in standing blood pressure. Multiple medications can cause these symptoms and increase the risk of falls. Some of our friends are also experiencing age-related physical decline. Many of our participants will have arthritis or osteoporosis, maybe in the back, the knees, or the hips. They may have had a joint replacement or suffer from chronic pain related to previous injuries. Some other medical conditions that people may experience that can impact their gait steadiness is that they might have fluctuations in blood pressure when they are changing positions, when they are sitting and then when they go to stand. The correct term for this is called orthostatic hypotension. This may make a person feel faint or have poor balance when first standing because they experience a drop in blood pressure. Our participants may also suffer from fatigue. Other conditions, such as Parkinson's disease, or if a person has had a stroke, or may also impact their walking ability. So what can we do to keep everyone safe and reduce falls at our centers? The first important tip is to assess for fall risk upon admission and then to daily reassess as well. Each person should be assessed upon admission for fall risk and mobility. Can a person stand and sit independently? Do they require verbal prompts or mild contact guard? Does a person use a cane or a walker appropriately? Staff should also be observing participants daily and report to the nurse or administrator any changes they see in gait as soon as possible. Something simple like the participant not having enough sleep the night before or being dehydrated could impact their safety when walking on any given day. Secondly, we must closely monitor participants when they are walking. If they are using an assistive device such as a cane or a walker, are they using it properly? Is it the right fit for them? Referring families to a consultation with a physical or occupational therapist is always a good idea to make sure that the equipment matches the person's needs. Third, encourage participants to wear safe, non-slip shoes that fit properly. Make sure that the day program environment is free of obstacles that may cause a person to trip or fall. Keep participant walkers, canes, and activity aids such as exercise equipment out of the main path where people need to walk to exit or enter the room. Encourage participants to use handrails in the hallways and also in the bathrooms. And lastly, providing supervision and the assistance as needed is the best safety tip. Keep a watchful eye, offer an arm to lean on, or gentle prompts in correct use of a cane or walker. If you are looking for an example of an easy way to track participant fall risk, check out the Foundation's Daily Falls Risk Assessment on page 93 of the manual. Wandering is a very common occurrence with people who are experiencing memory disorders. Wandering can be a sign of pain. Many people with dementia cannot identify the discomfort that they feel, such as where the pain may be. It may also be caused by boredom or excessive energy. Wandering can be an expression of anxiety or agitation, or a reaction to a new environment, or a signal that a person needs more physical activity. Oftentimes, people who are wandering forget where they are going and why they are going there. Here are some things we can do to keep participants safe who may tend to wander. Let's start with making sure that everyone in the center has some form of identification just in case they would wander outside of the building, which will help us locate them and first responders identify them. Then let's try to understand the reason why a person may be wandering. Maybe they have the need to use the bathroom and forget where it is, or they are in pain from sitting, or worried about a family member. If we know what may be bothering them, we may be able to reassure and redirect them, which will prevent the wandering from occurring. If a person is up and wandering, options include offering them a safe and closed space where they can walk to use up some energy. You can also try to get them engaged in another activity such as dancing, singing, looking at pictures, or engaging in exercise. If a person is appropriately stimulated, they may be less apt to wander. Always make sure that your security or wander guard system is functioning properly. Check that the doors are secure and locked if they are supposed to be locked. Some day centers report that disguising an extra door in an activity room with a large picture or mural can be a way to avoid the trigger for a person to want to leave the room and wander. Now that we've reviewed fall prevention and managing wandering, let's talk about some other risks we can avoid during activity time. Many of us are offering interesting and enjoyable craft activities for our participants. Many of these crafts and even other recreational sessions, such as bingo, involve the use of small objects such as bingo chips or paintbrushes or paints or other small objects that a person can pick up. Not everyone will attempt to put a small object in their mouth, but be aware of the risks that small, non-edible objects may pose for some of our friends participating in adult day. Changes in the brain and vision may cause a person with memory loss to mistake beads from a beading activity for candy. We once had a participant attempt to eat potting soil during a planting seeds activity. Another day program staff member reported the occasional occurrence of a participant trying to drink the paint water used for a watercoloring activity. We never know when someone may mistake an inedible object for food, so during activities, stay close and have plenty of staff on hand to observe, offer assistance, and redirection. If you are using items such as hot glue guns, make sure that the tools are out of the reach of participants to avoid accidental injury. Meal times are also occasions for us to think about safety. It's a good idea to make sure that everyone has an opportunity to wash their hands or use sanitizer prior to eating. This can help us avoid someone getting bacteria from food while they're eating. When serving food, we want to be mindful of providing the right consistency of food for the person based on any issues they may have with swallowing or chewing. Discreetly cut the food for clients who have difficulty cutting their own food. Provide soft foods as needed. Again, staff supervision is key, especially during meal and snack times. Some participants may be slower eaters than others, and some participants may reach over and take food or snacks off of another participant's plate. Think ahead and sit peer strategically so they cannot reach food on someone else's plate. This is especially important as many of our participants may have food allergies or restrictions related to conditions such as diabetes. If this is the case, we want to avoid someone who eats a diabetic diet from eating cookies off of a friend's plate. Many of our friends may bring food from home that was stashed in their purse or pocket. And sometimes we've encountered a participant who wanted to take half of their sandwich home from lunch to eat later. Remember that food-borne illnesses related to improperly stored foods can cause severe illness. Offer safer alternatives for your participant who may need to take home a snack, such as giving them a shelf-stable, prepackaged item that does not need refrigeration. And finally, make sure that the temperature is safe for food and liquids. We may ourselves know to wait a few minutes while our hot cup of coffee or hot bowl of soup cools down. Our participants, due to their memory impairment, may not wait and can be at risk of burns. So be sure to only serve food and liquids at a temperature that will not cause a burn if ingested, or a burn on the skin if the cup of liquid is accidentally knocked over. When we think about safety, dehydration may not be at the top of the list, but it is so very important. Our friends at the center may not remember to drink water and become dehydrated, which can lead to increased confusion, unsteadiness, and even changes in blood pressure, which can increase the risk of falls. What can we do? We can offer water throughout the day. It doesn't have to be a big cup. Even smaller cups more frequently can help keep a person hydrated, especially during the warmer months. Offer extra liquids. Broth-based soups also count. When discussing safety issues, we also need to consider how we can keep everyone safe in the event that one of our participants is acting in a way that is threatening or dangerous to others. Individuals with memory impairment may become combative and lash out verbally or physically. The person is in fight mode and may strike or harm anyone in their way. Combative behavior may appear suddenly and happen during an exchange, such as when we are helping a participant in the bathroom or giving them direction during an activity. Individuals with memory loss may also experience what we call a catastrophic reaction. This is a behavior that is severe, intense, and extended in duration. It may involve yelling, screaming, crying, aggression, violent outbursts, or fleeing with the level of emotion expressed not in keeping with the situation. Someone experiencing a catastrophic reaction may act combatively with peers and staff. Combative behaviors and catastrophic reactions pose safety risks for both staff and clients. Here are some things we can do to help de-escalate a participant who is displaying behavior that is harmful to others. First, stay calm. Remove yourself and other participants from harm's way. From a safe distance, if you are able, acknowledge the person's feelings and offer reassurance. Some centers find it helpful to have a separate room where a person who is lashing out can be moved to so they are not a threat to other participants. Remember that your safety is important too. If you are in a confined space or alone with a combative person, alert your fellow staff members to the danger of your situation. Do not go alone into a room with a combative person unless there are other staff in the wings watching and ready to immediately intervene and come to your assistance. Be mindful of where the door is so you can make a quick exit. The final safety area for us to review is delirium. Delirium is an acute medical condition that is life-threatening. Let's review some of the signs and symptoms. If you notice any of these in your participants, immediately alert your staff nurse or supervisor, as the person will need medical emergency attention. Some signs to look for include very sudden changes in a person's level of attention. A person may become very lethargic and sleepy or they may get very activated and hyper. The behavior will be abnormal from how they usually are, and it can fluctuate. Their thinking may be more disorganized than usual. Their speech may be incoherent and not make any sense, which would be different from how they usually engage with you. There is always an underlying medical reason causing the delirium. Some common causes include dehydration, having an infection such as a urinary tract infection, having an underlying illness such as the flu or COVID, or experiencing a problem with medications. Your staff nurse will be able to properly assess and call for emergency assistance. Once the underlying cause is identified and resolved, the delirium should end. Thank you for your attention in reviewing these very important areas related to safety in adult day programs. If you'd like to rate your center safety, check out page 91 of the Foundation's workbook for a handy checklist that allows you to rate the many areas we have discussed. Remember, prevention is key. We've covered some very important information in this session. Know that you are your center's greatest safety asset. Today we have learned there are many things you can do to help prevent falls, to manage wandering risks, to reduce risks during activities, to keep everyone safe during mealtime, what to do if a participant is combative, and how to observe for delirium. Your efforts to provide a safe environment for our friends with memory loss and your coworkers truly makes this world a better place. Thank you for your attention and your willingness to learn about safety. I hope the information shared in this session will make your job easier. For more information, please contact us at 800-424-2494. You may also download the Foundation's workbook at www.care2caregivers.com.